Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Figures from the NCDC indicate infection rates for coronavirus on the rise as more states intensify enforcement drives. Delta and Emo State initiate stiffer punishments for COVID-19 defaulters, warn residents to avoid being caught unawares. And Africa Center for Disease Control says they still have an eye on the AstraZeneca vaccine. Today is the International Day of Women and Girls in Science, and this gender all over the world, especially on the front lines in science and technology, are being applauded for their effort in the fight against the pandemic. But still, the coronavirus cases are climbing, with figures from the Nigeria Center for Disease Control showing the latest record of over 1,000 cases in 22 states and the FCT. Meanwhile, the latest figure also indicates that 1,192 patients were discharged last night, increasing the total number of recoveries to 116,947. According to the NCDC, Wednesday's recoveries include 773 persons discharged in Lagos State and 66 community recoveries in Emo State who were managed in line with the guidelines. With 8 new deaths recorded, more than 1,700 people have died from COVID-19 in Nigeria since the disease first appeared in the country almost a year ago. Since the beginning of this year, there has been an upscale in daily deaths from the virus in what public health experts attribute to the spike in new cases officially tagged the second wave, resulting in shortages in oxygen supply for patients in critical conditions. Among other states with confirmed cases, Lagos, the epicenter of the pandemic, topped the list with 297 infections, bringing the total of confirmed cases to 142,578. Total active cases across the country stands at 23,929, while the country is still expecting its first batch of the COVID-19 vaccines this month. How to keep the state safe in the advent of the second wave of COVID-19 is a priority for the government of Jigawa State. They disagree with opinions that the state has left some gap in its management of the pandemic. The Permanent Secretary, Ministry of Health, Dr. Salisu Muazu, who doubles as a chairman of the state's task force on COVID-19, confirms that a lot of progress is being made to keep the state free from the virus.
In the last 8 or 9 months that we have been having COVID-19 in the state, we have tested a significant number of patients. We had positive cases. Recently, when we had the NYC camp that was open about 2 or 3 times, we are all aware of the cases that we have. So I think there is a gap. Maybe the PTF didn't bother to maybe find out from the NCDC or hear from our own end, because up to today, we have not had any contact with PTF to tell us where is our own deficit or where we make mistakes to engage us so that they can correct us. We are still waiting for that, but we didn't hear from them.
Meanwhile, academic activities are underway in the University of Calabar, Cross River State, but there are worries on the maintenance of safety protocol by students and the university community. Speaking shortly after a tour to the university, the Commissioner for Health, Dr. Betta Edu, in company of the Vice-Chancellor of the university, explains that government and the school authority will collaborate in making sure that the schools are safe while learning activities are in progress.
For me, I'm most proud that University of Calabar would again be setting the pace in Nigeria, because we have just laid foundation for an ultra-modern isolation stroke holding bay in University of Calabar. It's going to be a double tent for male and female, and people who are suspected cases can be kept there until the rapid response team from the state is called upon to come and pick these cases. So we're proud of what they're doing. We are going to support them all the way. We have already assigned a team that will be on ground with them to continue the monitoring and the implementation of all the COVID-19 protocols. For me, I'll give them a very high pass mark.
we have tried to put in place all the protective things that will help. For instance, through the entry points, in each of the entry points, we have sanitizer tunnels, and we are connecting them. Now, some are already working at the administrative block, at the library. We have them. We also have these standing infrared thermometers, about 20 of them that have been distributed. Then we have about 100 of hand infrared thermometers.
Well, let's take you to Delta State, where the Chief Judge of the state, Justice Marsha Umukoro, has directed mobile courts to ensure that people who fail to comply to the protocols of COVID-19, if found guilty, be given stiff penalties. The Justice announced this in Asaba at the reopening of the rebuilt High Court complex, which was burnt down during the NSAS protest last year, calling on the public not to flout the rules by the NCDC. Part of his statement reads, quote, "As from today, the mobile court on COVID-19 will start sitting. So the media spread the news, let the people know that anyone not wearing the face masks and other protocols will be prosecuted." And to the southeast, where Emo State, the state's COVID-19 task force, has begun enforcement of the safety protocols to ensure that residents of the state comply. In our next report, our correspondent, Eita Kwekuteyi, who monitored the compliance within the state, reports that one supermarket was sealed due to failure to comply with the protocols.
It's a busy day for officials of the Emo State COVID-19 task force and their partner security agencies. From one major road to another, from one vehicle to another, the officials monitor compliance levels, especially the use of face masks. Reporters are taken to a mobile court where it's the option of fines or imprisonment. From monitoring the roads, the team moves to some busy supermarkets and phone spots within Owerri to monitor conformity, especially the provision of hand-washing facilities or offering of sanitizer as well as infrared thermometers for customers. While some had air, others who defaulted were sealed till further notice. According to some of the officials, this exercise is not to witch hunt anyone, but to ensure that all protocols and guidelines are followed to reduce the spread of COVID-19 in the state.
This is to motorists and to everybody that will be in a car, whether it's a private car or a commercial car, that as far as you are more than one person inside the car, you must be on your face mask. Without it, you're violating the law. And when you are caught, you face the wrath of the law.
So part of why we are here is to make sure that we reduce the spread, because if you keep quiet, people will continue to die. So we want more people to understand that. Like he said, we're not witch-hunting anybody. We don't want to stop anybody from doing business. But all our interest is to make sure that people are safe.
While speaking on the guidelines and protocols, the chairman of the COVID-19 task force urges Emo residents to support the government in the fight against COVID-19.
Whenever you're in public, maintain social distance in all functions and try to have a system for personal hygiene, washing their hands with soap and water and or with hand sanitizers.
The officials say this exercise will continue as long as the coronavirus remains. Eita Kwekuteyi, Channels Television News.
Well, Dr. DK Okechukwu, the Vice Chairman, Nigeria Medical Association, Emo State, also President, Medical Excellence Foundation for Africa, joins us right now. Thank you for joining us on the program. I'd like to quickly ask what your take is in the state government's effort. I mean, the punishments, the stiffer penalties, all in trying to curb the spread of the coronavirus there.
Yeah, thank you, Millicent, for having me. It's my utmost pleasure. Generally, the governments at all levels are trying to intensify efforts at, bringing people to understand that we need to fight this pandemic to a standstill and prevent unnecessary loss of lives. We all know that in established protocols and have been adhered to and follow strictly. I most particularly commend the COVID-19 task force. They've been visiting worship institutions and some other establishments, trying to sensitize people on the need to, adopt all those safety measures. I must also commend some corporate organizations, some other media establishments in the state, and the Nigerian Medical Association for its efforts in, trying to educate people and trying to make people to understand that we all need to be safe. But on the other hand, you may start wondering why an individual, an adult that is supposed to understand that these practices are supposed to help secure his life and lives of the loved ones. When you take sample of the people in the states, you see some dissatisfaction amongst the citizens, people, saying all sorts of things, not being happy with the way the COVID-19 is being handled. And you cannot come and be, shutting people down, trying to force people to believe in what you're trying to pass across to them. When, on the other hand, you are not also doing some other things you need to do as a government, as a people, to ensure that people are not just only safe from getting infected of the COVID-19. They have to also stay alive. Some people have not been, paid their salaries. As I speak to you, most of the government-owned health institutions are shut down, and you cannot claim to be fighting genuinely the COVID-19 when the institutions are shut down and people do not have access to healthcare. In as much as I'm a healthcare advocate, I talk often about these safe practices, and I insist that people, adopt them and make sure that they practice them. But I also talk about the need for us to have our institutions up and running, so that people who are also inadvertently infected can also access care in the state's health institutions. But sadly, as I speak to you, all of them are shut down and people in the state cannot access health care. If a government is, not interested in restoring services, how do we expect people to now abide by the rules and regulations preventive measures against COVID-19? So it's something that we have to be all-inclusive in handling, not just coming to the media to say that you're shutting down shops and doing this. When people see that genuineness in you and seeing that you are having their interest at heart, you pay them their salaries, get the institutions working, they don't need anybody to tell them that you need to observe all these safety protocols. We say it often. Me, I've said it before, a healthcare advocate. I talk to people in the rural communities. I talk to people in the markets, in the churches, in consulting room. You get the same feedback that the government is not genuine in the fight against COVID-19. That how can you owe people pension, salaries, and health institutions shut down, and you are claiming to be fighting COVID-19? That is not the appropriate thing.
So, Dr. Okechukwu, essentially the unique challenge there in Emo State. But then, on the other hand, what is the government saying? I mean, leaving institutions shut down when we're facing a pandemic, and this is aside other diseases as well.
Thank you. The last time I checked, nothing meaningful had been said about restoring services in the shut down institutions. That's very sad. And those of us in Medical Excellence Foundation of Africa and the people in the Nigerian Medical Association, they've been trying to get the government to understand that we need to get all these institutions up and running and ensure that the good people of Emo State can access care whenever they need such care for themselves and their families.
All right. We'd like to appreciate your time on the program. Dr. D.K. Okechukwu, Vice Chairman, NMA, Emo State, President, Medical Excellence Foundation for Africa. Thank you for joining us on the program.
It's my pleasure, Lisa. Thank you very much.
Still to come, Northeast Development Commission donates PPEs to frontline workers. That's in a moment. And the Northeast Development Commission has donated personal protective equipment to frontline workers and vulnerable groups in Bauchi State. This is an effort geared towards minimizing the spread of the virus in the state. The NEDC Managing Director, Mohammed Al-Khali, presented the items to the beneficiaries at the Government House, Bauchi.
To support further the effort of the Executive Governor of Bauchi State in curbing the spread of disease, I am glad to inform you that NADC is not relenting in taking relevant proactive measures in this regard. To this end, we are hereby donating some items to boost personal protection against COVID-19, especially among school children in both public and private schools, security agencies, and, very important, the National Union of Road Transport Workers, whose members commit thousands of passengers daily in the state. The items we are donating include 10,000 pieces of branded face masks for public primary schools in the state, 5,000 pieces of branded face masks for private primary schools, 4,000 branded face masks for military and other security agencies in the state, 2,000 pieces of hand sanitizers, and 100 pieces of infrared thermometers for the primary schools.
Well, Dr. Ejike Orji is the Chairman Medical Staff Committee, the FCT's Ministerial Expert Advisory Committee on COVID-19. He joins us right now. Thank you for joining us on the program. Now, I'd like to begin at the start of the year. Nigeria's president approved the release of about 6.45 billion naira to set up oxygen production plants in 38 sites to help treat COVID-19 patients. And then the Lagos State governor also said the demand for oxygen has increased fivefold. What is it about this second wave that there's so much need for the plants, quite different from the first wave?
Yeah, thank you, Millicent, for having me. Remember that in the first wave, there was so much public education and some level of community engagement by the government. There was a lockdown, and I said the lockdown actually made two things happen. One is optics. You made people understand that this is serious for the government to shut down everywhere, including the economy. And two, it actually also stopped the spread of the disease in some way, but also gave the government some breathing space to be able to set up some structures to be able to fight the pandemic. But what happened was after the lockdown was over, people came out, and because of that initial action, the disease stopped spreading rapidly. And then remember too, the demographics of our population, 70% of our population is under the age of 30. And that means they have high level of immunity. And then you have 70 or more.
Oh dear, we seem to be losing Dr. Orji there, but hopefully we'll try to get a hold of him on that. But then let's tell you also several other stories. This is the Secretary of State government. It has instituted a 14-man committee of Nigeria COVID-19 Action, Recovery and Economic Stimulus to be chaired by the State Commissioner for Budget and Economic Planning. Speaking during the inauguration of the committee, the Secretary of State governor says the committee is to provide strategic basis for expanding access to means of livelihood support, food security services and grants for the poor and vulnerable. I believe we have Dr. Ejike Orji with us. If not, then Europe's oldest person, talking about Sister Andrea. She's marked her 117th birthday in France with a special mass, a video call with family. Her carers had worried that she would not survive to see the birthday after she contracted the coronavirus recently. Sister Andrea herself did not realize she had contracted the virus at her retirement home in Toulon, France. All right, we have Dr. Ejike with us now. Welcome back. If you can continue from where you stopped.
Yes, I'm so sorry. I had a glitch.
I know
yes, what I was saying is that
that
gave the impression to people. Yes, that gave the impression to the people that this disease is not in non-existence. Young people were running around, going to bars, making noise, and then of course, they were getting the virus, but nothing really was happening to them. They were taking it back to their fathers and senior uncles and grandfathers and mothers. So when the second wave came, even the elderly people did not take it serious. I heard a lot of people say that I treated malaria for 1 week. It is only when they started coughing and desaturating that they realized it was COVID and do COVID tests. So what happened? Let me give you a simple analysis. In the first wave, in Gwagwalada Teaching Hospital, they had 35 patients at some points. Only 2 of them was on intermittent oxygen, not continuous, because they came early. In the second wave, there was, at a point, 36 patients, and 15 of them were on continuous oxygen because they came late. They were desaturating. And so they overwhelmed the services there. So the place that was made to have just 4 oxygen cylinders a day suddenly started consuming 20 cylinders of oxygen in one day. So that is the problem, is the severity of the second wave based on the fact that people were coming to the hospital late. And remember, this new variant, we're still doing a genomic analysis in Nigeria to confirm what variants that we have now. But it can be seen the transmission rate is higher in some areas in the world. And then, so if you take, for example, that you have 10 people being infected in the first wave per day or per unit time, this time around is 7 times. That's 70 people being infected per unit time. So the demand for services will increase per unit time. And that is what has put so much pressure on all the hospitals that are giving critical and severe care treatment. And that's why oxygen demand went up so high. If it wasn't for the intervention of the PTF, there was a time Gwagwalada was almost shutting down because there was no oxygen. They intervened quickly and made sure they had the oxygen that they needed, including the National Hospital. So this is the reason why the oxygen has gone up.
Dr. Ejike Oji, we hope to have you in the studio. Safe travels. We'd like to thank you for joining us on the program.
Thank you, Millicent.
All right. Meanwhile, we told you about Europe's oldest person celebrating her birthday. There's also a number and increase in global coronavirus cases. We're looking beyond 107 million and also deaths beyond 2.3 million. Let's take a look at the global update.
The World Health Organization says there has been a lot of open, transparent discussions in the joint work of the World Health Organization experts and Chinese scientists in Wuhan. This came from a member of the investigating team following the conclusion of investigation by a joint WHO-China experts team on the origins of the coronavirus. Peter Daszak, a zoologist, a member of the team, who spoke highly of the conduct of the Chinese scientists that collected samples at the Yunnan seafood wholesale market, a place associated with the earliest COVID-19 outbreak in China. Meanwhile, the Africa Union Center for Disease Control says it is not walking away from the AstraZeneca COVID-19 vaccine after trial data showed it had greatly reduced efficacy against the variants dominant in South Africa. African countries are due to receive 100 million doses of the AstraZeneca shots this year under an AU vaccine plan. South Africa paused the rollout of the vaccine to health workers and says it could seek to sell or swap doses of the vaccine. Over in Germany, Chancellor Angela Merkel has called on citizens to be a little more patient after agreeing with regional leaders to extend the coronavirus lockdown until March 7th, saying restrictions would not be kept for a day longer than necessary. She was addressing the Bundestag lower house of parliament, where she also mentioned that the extension was needed to avoid a third wave of coronavirus due to the risk posed by new variants of the virus. Coronavirus infections are falling in Spain, though many hospitals are still operating under much pressure. The country is ebbing, with a 14-day infection day falling to 630 per 100,000 people on Tuesday, compared to around 900 in late January. Finally, health authorities in Australia's Victoria State have ramped up contact tracing and prepared for more mass testing of residents in Melbourne after a new COVID-19 cluster linked to a quarantine hotel grew to 10 cases today. More than 22,500 test results have been conducted in the last 24 hours in the country's second most populous city, and authorities are calling on residents to get tested amid fears of community transmission from a worker at the Holiday Inn in the city.
Well, continue to take responsibility. You can visit our website. It's channelstv.com for more updates, a better understanding of the pandemic, plus several other stories. That's the program. Thank you for watching. I'm Millicent Walker. Stay healthy.